Hey, welcome everybody to the webinar today. We are so glad to have our speakers today. Welcome. I see there's a few more people joining in, attending the webinar. So I'm going to give just a quick highlight of where we are going today, what our conversation is going to be around while our last few attendees join in, and then we'll do introductions and jump in. So today we are talking about, from the pharmacy faculty perspective, some of the challenges around preparing students for NAPLEX. And we have with us today two of our editorial board members, Tony Vestai and Cassie Boland, who also have spent many years teaching in pharmacy academia. So I thought it'd be a great conversation to get their perspective and their experiences preparing students and some of the challenges there. And then we also have Leslie with us, who works with our institution, so that as we circle back at the end of the conversation, I want to just talk a little bit about our practical experience working with pharmacy schools these last few years and what we've seen be really effective and where some of the challenges have been. So I think it'll be a great conversation. Really appreciate all of you making time for this today. If there's questions, you can feel free to put them in the chat or shoot them in an email. We'd love to connect with you. But let's just kick this off. We want to respect your time, and we'll start with introductions. So I'll go first since I am our host today. My name's Tamsin Baker. I am president of our institutional product division. So I am over our products that we work with pharmacy institutions, as well as those for nurse practitioner programs, PA programs, and hospitals. We have Leslie with us today. Leslie, you want to introduce yourself?
Hi, yes. So I am the Director of Institutional Accounts, and that means that I work directly with our partnering institutions and the faculty, helping them identify which packages and components fits best and helping them implement our product throughout the year to prepare students for the NAPLEX.
Super. Cassie, why don't you give your introduction?
I am Dr. Cassie Boland. I am a PharmD, and at High Yield Med Reviews, I'm the Director of Curriculum and Assessment. And I have practiced in academia for over 10 years and clinical pharmacy as practice faculty in the teaching didactic portions of academia as well.
So, Dr. Bestay?
Well, first of all, thank you, Tamsin and Leslie, for inviting us to be here. And thanks for all of you who are watching this and participating, because this is a really important topic that and things that you have to face on a daily basis, not every academic year. So thanks for joining us. My background is a little bit different. I'm the owner founder of the company, but I primarily serve in my role as editor-in-chief, and as it relates to product development and some of the services that we provide. And as it relates to academia, I've been involved in pharmacy academia for over 10 years. When I was in academia, I also had a clinical appointment, mainly in internal medicine, was a residency program director for both internal medicine and pharmacotherapy residency training programs for pharmacists. So really excited to be here and talk about this important subject as we prepare the next generation of pharmacists for you guys.
Super, thanks. And really, we appreciate y'all being here. I think it's going to be a great conversation. Dr. Bestai, why don't you start us? I want to just address kind of the elephant in the room. We've seen so much chatter the last 3 years. This last set of NAPLEX exam results came out, and there was just more fluctuation than we've traditionally seen. I mean, there have been those years where everybody dropped or where all the scores seem to go up, but the last 3 years have been kind of all over the map. From your perspective, what do you think are some of the contributing factors?
Yeah, it's a great question. And I think just like with a lot of things, there's more than one factor. So, there's a number of components that you should consider. One, and the most obvious is, we've just gone through a pandemic and, lasting over, approximately 2 years. That impacted a large number of students, especially in those last parts of their pharmacy training where they took the core knowledge that they learned in the first 2 years and really started to take them into the clinical practice environment where you're applying it. And when that part was compromised, I think it also compromises that higher level of integration of the knowledge transfer that we really try to get students to, and that the board exams are also wanting to assess, because at the end of the day, they have to make critical decisions that are going to impact patient lives. And you get that experience by taking care of patients. And certainly the pandemic has compromised that last phase for a group of folks that I hope will hopefully go away. But it's certainly a factor to consider. The other one is, there have been some changes over the years with the exam blueprint itself, and that has created some adjustments where programs may make curriculum changes that don't manifest right away. It may take several years for those to compensate for some of the variations. But I certainly think those, two things, maybe a third that's also something that I've noticed, even as a practicing clinician still myself, is that the number of medications coming out is not decreasing. I mean, I have to try to keep up with all of these, and especially the new biologic agents. Man, some of them are very complicated and very specific in their mechanisms and how we use them in patient care scenarios. And so when you continue to accumulate the amount of medications and drug therapies with unique dosing regimens and uses in patients to the overall existing, arsenal of medicines that we use, that's a lot to try to keep in your mind, right? So I think a lot of times students have to go through phases of, how much do they rely on their memory versus rely on sources. And those sources, unfortunately, are not available on the real exam. And so, it becomes a challenge, especially for faculty and programs, as they try to prepare the student to, meet all of these things, knowing that at the end of the day, they got to take care of that patient. And that's where that last year, really where the pandemic probably hit most.
Yeah, it sounds like it's a challenge, two different challenges, but they meet up together in preparing these students for practice. But then also, like you're saying, that for the exam piece has some of its own unique challenges. Dr. Bolin, I've got one for you. So I am not a pharmacist. It makes sense to me that students obviously are very concerned about passing this exam because that's kind of the final barrier after they're graduating and having finished their program to be able to be licensed to practice. But I hear all the time from faculty we work with, there's clearly a driving real weight on the schools to make sure that their pass rates are quite high as well. So I was curious from your perspective, having been faculty, what you feel like some of those drivers are that make NAPLEX pass score so important for the universities that are having to educate these students.
Sure. The NAPLEX scores are definitely something that is important to the schools. Probably number one, because it's part of the ACPE standards for the pharmacy schools, that they produce and make available publicly what their scores are. So that's something that cannot be hidden. You can't try to, explain it away when students are looking at your school. You've got to have the chance to get them in front of you first to explain if there's been a curriculum change or some sort of adjustments. And so students, especially your higher performing students, are going to look for the schools with the higher NAPLEX scores, which can affect your admission rates, your subsequent admission rates, and a lot of other things coming through your program, the outcomes of your program. So it's very important to schools that you can produce good NAPLEX scores. And for students, it's important because they want to be sure that when they put their money into their schooling, that they can graduate and then that they can get a job to, have to function in their life, to be able to repay their loans and things like that. And then ultimately, it should be important because the NAPLEX is a marker of competency. And so we want to be able to say and know that our school and have some way, quantitatively to show that our school puts forth competent pharmacists who are going to provide good patient care, excellent patient care, and not harm our patients and community. So I would say that those are some of the big overarching reasons why schools appreciate and want their NAPLEX scores to be good.
Thanks, Dr. Boland. That's super helpful. Dr. Beste, maybe we can hop back to you, and then Dr. Boland, I'd like your input too. But having both actually been in the faculty seat in academia, I'm curious, what are some of the challenges for preparing students for the NAPLEX exam? I mean, I know programs run oftentimes 4 years, some 3 years. They have quite a bit of time to prepare these students. And then, like you said, Dr. Boland, which is such a passionate high yield, ultimately they're preparing these students to be practitioners, to care for patients, to be competent in practice, but they also have this barrier of the NAPLEX exam that they have to get past. So what do you feel like are some of the specific challenges to preparing students to be successful on this exam? Dr. Beste, if you want to go first.
Yeah, I mean, as faculty, we have a responsibility to the institution and the program itself and its goals and purposes for existing, but also to the state and the profession and public health. So, as a faculty member, I'm wearing two hats. I've got to help these students not only achieve the level of knowledge and competency to go out and take care of real patients. That's my professional and ethical responsibility. But the other part of that, which is a little bit different of a mindset, is that they have to take the exam to get to that point, right? So they've got to pass that hurdle. It's not just graduating and getting the degree. They've got to pass that test. Well, taking a test is a different approach. So you have to practice doing both. What is it like to be a real world pharmacist taking care of patients? And what is it like to take a 225 question exam that could take up to 6 hours that requires not only the application of a wide variety of knowledge and core concepts that you've been learning, but that you have to be able to endure it for that long of a time period. So, what are the skill sets that are needed to take this test and pass it to demonstrate what you really know and you're probably good at, but you've got to put into the form of answering a multiple choice question. So we've got to help students. And I think one of the difficulties with students that are very busy, they got a lot of things going on, a lot of demands on them. And we say, well, you need to do practice test questions because guess what? You have to answer real practice test questions that are multiple choice on an exam to pass. So if you don't practice doing what you're expected to do, both as a real world clinical pharmacist, but also taking this test, then you're not going to be prepared. And sometimes it's hard to get the student motivated to see the relevance of that because they haven't taken that exam. They don't know the stakes of it, and they're worried about the next thing on their to-do list. And the other thing that I think is difficulty, in my opinion, trying to get students motivated to start early. A lot of times we go through, I've been studying pharmacology and drug therapy and pharmacy for 4 years. I mean, do I really need to study? Well, back in my day, the exam was a little bit different. The pass rates were much higher back then. And we also didn't have access to a lot of electronic resources that a lot of times this current generation does rely on. I rely on it too. I mean, technology is a good thing, but that technology is not going to be available on the exam. So you've got to get these students to start earlier and integrate it into the curriculum as they're going through it so that they really understand the concept. Because if you understand the concept, then you can apply it to any multiple choice question given to you. And trying to get the student to see those two different perspectives and the fact that they can't look up something on their phone, they can't open a web browser during the exam. And while they may have done that throughout most of their clinical rotations, that doesn't exist on the exam. So it's hard to get them to see that sometimes because we're used to doing it on a day-to-day basis. At least that's been my experience.
Yeah, I can imagine just having those resources at your fingertips all the time, which is great and great in practice even.
Yeah.
It's hard to realize what do you really know if you're not working without them.
Exactly.
And then I think too about, we have our online sales division where people are just purchasing courses on their own.
Yeah.
And certainly our volume of NAPLEX sales is much higher later in the year, which makes me think you're absolutely right. Students, if left to their own devices, are probably not thinking about the exam and preparing, most students as early in the year as they need to. Cassie, do you have anything to kind of add from a faculty perspective, challenges you feel like you experienced as a faculty member with getting students to prepare, or difficulty with just making sure they are prepared?
I think in thinking about just make the difficulty in making sure that they are prepared is when you think about the way that curriculums are usually laid out, the topics are generally covered really well, very thoroughly in one place, at one moment. And then we use other formats to bring those back in from time to time. So you integrate it with cases and you'll bring back, what is your goal blood pressure and things like that. But if students miss the core material for whatever reason that they miss it, if they don't understand it the first time, if they get parts of it but not other parts of it, there's really not another place where they are forced to supplement their learning. And so what happens, then, and what can be good is to give them that additional opportunity to hear another faculty voice, another professional voice, teach that to them, either to solidify what they did learn or to give them the opportunity to learn what they did not learn. So I think that is another challenge, is that the curriculum is so heavy that you don't have a lot of time to go back and go over and over and over again. And if they don't study it well the first time, if they do any of the, load and dump type of studying, then they're not as prepared as they should be.
So it sounds like it's not only the reality. I mean, it makes perfect sense. There's always going to be gaps, whether it was a student had COVID, during that particular course, or
Yes.
maybe didn't learn as well from that particular faculty member, or any, like you said, any had bad breakup. Who knows? For whatever reason,
Sure.
missed the content the first time through. But even identifying where those gaps are, I imagine, can
Yes,
be a challenge for the students.
absolutely.
So from the student level, let's kind of turn that around. We've talked a little bit from the faculty, and since we've got you in the bigger square, Cassie, we'll start with you. From the student level, what do you feel like are some of their particular, and they may be the same things, I don't know, but maybe some of the specific student challenges with being prepared for the NAPLEX exam?
Yeah, I think you can definitely, emphasize the technology piece and trying to get them to understand that they really do have to know this. I used to give my students the example that there are a lot of educated people that can read guidelines and know what it said. You can read a guideline, if you have, your education and understand that, well, metformin, well, maybe not anymore, but used to be considered first line for, diabetes management. Just to give a quick example, like I said, maybe not anymore, but that's a pretty well known one. And I would tell them, someone can read that, but you need to understand why that is. And you need to understand why that would not be your first choice. And then what would be your second choice? And then why would that be your second choice? And you need to be able to walk through all of these things um, just to without having information directly in front of you or something telling you what to do in an algorithm. You need to be able to think on your feet. And then, we've already touched on getting them to start early enough. And I think another big thing is students are very easily distracted. They're distracted by service, by trying to get leadership positions, additional projects. And why are they so motivated to do that? Well, because residency programs are very competitive. And it's becoming more and more apparent that to get, certain types of positions, you need to be looking for residency training or fellowship training. And so they get very distracted with that for a good reason, but still, you have to have a way to bring, to get them to come back and focus and realize that they're not going to get the residency if they don't have the foundation to pass the NAPLEX and help them to be, a good clinical practitioner or whatever, area they may be going into. So I think those are some things, and then not to mention the students who have to work, through school. That is a big distraction because there are personal and social issues, that go into that for them as well. they're difficult to navigate. So they need some guardrails to kind of help them understand and know that this is not, you can't put pharmacy school in buckets and NAPLEX is your May bucket. You can't
Right.
start in May.
I mean, it's kind of that classic idea that the enemy of great is good and all those other things can crowd in and they're all good things. But without that
Sure.
motivation, without some of those, I like that word, guardrails, seems like a place where faculty can be really instrumental in helping students understand where the priorities, how to order things so that they don't end up in May just starting. One of the things, Dr. Besta, that Dr. Boland just said that I really appreciated was that idea of trying to get students to make the jump from you can know the guideline or you can have some of that head knowledge really crystal clear. But if they're not able to start connecting the dots and making those jumps, and they are not going to be as well prepared for practice, but also for those more challenging NAPLEX questions. You obviously started this company with some very particular reasons, some very specific philosophies on education. So it feels like this might be a good time for you to share a little bit about how have you developed this content with the rest of the editorial team, of course, but what is your approach to help meet that specific need of not allowing students to feel like they are ready simply because they've done many years of difficult schooling and can pass certain exams or feel like they know certain information off the top of their head, but maybe not able to go to that next further step of really applying it, thinking critically about it. It's just like your feedback there.
Yeah, I mean, the company and the products were developed under the premise of things that I witnessed in my own self, right? I mean, I realized that there were sometimes things that I didn't really understand, but when I understood the concept, I was more able to apply it, but even more importantly, I was able to remember it. And then I also found myself at times with fatigue and demands to find myself memorizing things and regurgitating it for an exam, but then moving on. Yes, I did well on the test, but I didn't retain that information long term. And so as I began to figure that out for myself, I recognized it also as a faculty member and many of the students that we get into this sort of pattern where we're just trying to survive. And we memorize, we regurgitate, but we're really not understanding why we do what we do. Or if you're answering multiple choice questions, which again, we have to do at some level, they may know how to take a test, but they may not always understand why it's the right answer. And so that bridge between having the core knowledge and then the critical thinking skills to apply it where you've understood the concept is where I saw the real need, and trying to develop content to try to bridge that gap in a way that is easy to understand, right? Evidence based, but then oriented to the patient in a way that it all came together. And that's the underlying premise for the approach to a lot of the products that were developed. And the second thing is that it needed to be comprehensive. One of the things I saw in myself is that I'd go on these rotations and in a geographic location, and those institutions commonly used a certain number of medicines all the time. But the reality is the board exam tests you on a lot of different treatments that may be used in other parts of the country. I wasn't experiencing that because I wasn't in that geographic location. But the reality is that those are all very well accepted practices of caring for these patients with these particular disease states. And so you need a tool that not only teaches you to understand the concept so you can apply it to any question, but it needs to be comprehensive. And that's the little bit of the fallacy of students in some programs where they're only teaching from within and they don't have outside influence, where there's other things coming from other parts of the country where it's a different, more objective approach sometimes. And then the last thing is that I considered when we were developing the platforms and the content was this fact. I like to read and learn things a different way than some other people do. Not everybody fits in a certain bucket or path or plan. And some people learn by listening, some people learn more by reading, some people learn by a combination of the two. And so when we developed the various components and study tools, it was really designed to be leveraged against any learning style or preference in a diversified group of students so that we wouldn't just pigeonhole everybody into one particular path, but it still gets everybody to the same endpoint, which is understanding those core concepts and understanding why you do what you do so that you can apply it to multiple choice questions on a test and pass it. But more importantly, apply it to the real world practice environment where you're taking care of patients who someone's mom, dad, sister, brother, loved one, or friend, or even you one day. So, we want to build that in. That was the premise for the development of the individual study tools and components of the company.
Love that. Well, I have one more question for our two faculty editors here, and then I want to move over to Leslie and ask her a couple questions about her experience with implementation. But Cassie, and then Tony, I'd like to hear yours as well. That you're no longer an active faculty member. You've now moved over where you're fully creating content for us. You're recording lectures and participating in the case reviews we do, and editing and writing QBank questions and editing, helping oversee our practice exams. So I want you to try to put your hat back on if you are actively a faculty right now, and now being just much more familiar, of course, with our tools and how our content is built. How do you feel like you would have benefited from having some of these tools for your students? Or maybe the flip way of asking that would be, if you were a faculty member right now, how do you imagine you would maybe use some of these tools to address some of those challenges that you experienced when you were a faculty member?
Yeah, and thinking about the content and the way that it's laid out, I think it's really content that you could choose to use and implement throughout the curriculum. But for sure, once they get into either their P3 or P4 year, when they start to go on rotations, they start to be a little bit in a little bit of a less didactic environment, when they start to really think about trying to use some of the information that they learned. I think that's a great opportunity to pick back up, to supplement, to put some of those guardrails in, and give them an opportunity to start relearning content or reviewing content or learning for the first time the content that they're now seeing. Because for me personally, and I saw it for a lot of students, what really helped the information cement into their brain was when they had learned it and then they were able to see it and put a patient or a situation or a decision with that information. So I think that's a great place for it, to give them that review in those later years. I'll let Dr. Busti add to that.
Well, and I love the idea, because I've heard it from students too, of not just treating NAPLEX prep as like when you get to the end, just review before you take an exam, but because they're on rotations and they're doing their API rotations, especially that final year, to be able to go back and visit that content, even if they did learn it the first time, when they're actually in the context of a clinical environment. I feel like many times students are able to connect the dots in ways that they just couldn't sitting in a classroom. In that purely didactic experience, to hear it again when they just saw a patient who had something more complicated than, the textbook example, I imagine really helps, like Dr. Busti said, helps them understand it in a new way because they're applying it in the situation. Dr. Busti, what do you have to add to that?
Yeah, I mean, I would definitely echo everything that Dr. Boland said. And I, remember being, on busy services where, we would do topic discussions, and, I loved leading those, but sometimes you get so busy that you can't cover all the topics that you're seeing in a clinical environment. And this is where that kind of flipped classroom model kind of thing can be very helpful, where you have a reference tool that you can tell a student, like, look, I know you have access to these lectures on this topic, and we just saw that patient. We don't have time to go over that disease state, but I need you to go listen to that. And tomorrow I want you to give me a brief synopsis of what you learned. And then I would encourage, what I felt like we also should do as faculty is coach and mentor the students to the patterns of success. And you encourage them to get in. I want you to answer 10 of those questions and tell me, maybe pick 3 or 4 of the most important points that you learned from those questions as you applied it after seeing 2 patients today. Do that. And we would commonly do that throughout my rotational experiences with my students. And it really helped them to build on their knowledge base, but also to solidify it. And then they got excited about it because it was starting to all make sense and the light bulbs were starting to go off and they were seeing that their decisions were actually helping people. That's where like it really comes together. And I think people really get on fire for what was the reason you became a pharmacist. It's not just to go get a job and make some money. You want to help people. Take the knowledge you've been given and apply it to somebody. It is one of the most rewarding experiences when you have that moment and you see that put into place.
Yeah, I think that's when learning becomes fun again and teaching becomes fun again, when you start
Yeah.
seeing those light bulb moments. All right, thank you both. I want us to hop over here for a minute and talk with Leslie, because we know our passion, Leslie and I, as we work with institutions with the rest of our team, is to see students be successful and faculty be successful. And we just spend so much of our time and energy trying to make sure that we are supporting our partnering institutions. And we've worked with schools that have implemented many different ways, some more successful than others. And so, Leslie, I would like to hear from you. Maybe what, if you were to pick three things that make schools the most successful in your experience, what would those be from an implementation standpoint?
Right. Well, thank you. So honestly, a lot of the things that Dr. Bustai and Dr. Bolin have already identified, schools that start early with NAPLEX review in that final year of pharmacy school. Some of them are even starting in May as soon as that final year begins, not May at the end of that year. Also having a graded requirement for the attached to the NAPLEX review, because again, that final year of pharmacy school is extremely busy. And when it's tied to a grade, the students are that much more likely to really pay attention and prepare and utilize the content. And then those that are using high yield provides data using the NAPLEX practice exam, and our QBank data identifies the gaps. As the students are answering questions, they're identifying where those gaps that exist for everybody and across across everybody's curriculum. It happens, but identifying them as they prepare rather than finding out, oops, once the NAPLEX hits.
Yeah. Yeah, that's great. I talked with a faculty member a couple weeks ago, and I was thinking of this as you were talking, Dr. Bolin, because you talked about kind of the issue of gaps. And she was saying to me, there is so much that they have to cover in the course of pharmacy curriculum. And even just hitting it all once is a challenge. But she was expressing to me her challenge with identifying, like, we don't even know for sure, like, do we have program gaps? Do we have curriculum gaps? And Leslie, what you're talking about is so helpful to our partnering institutions to get both individualized feedback from the QBank and from the NAPLEX exam, where students can see, I individually totally missed hypertension. I'm not answering questions well there. I need to review that. But also for a school to be able to see, like, across the board, our students aren't scoring as high as we'd like in maybe it's calculations or whatever the category might be, to see, are there overall areas where they could shore up a gap that's going to impact everybody. And having that kind of data is super powerful for making sure that across the board, if we want to bring NAPLEX scores up 10% for all of our students, here are some of the things that we can do that are data driven, not just our best guess at trying to do what's going to be helpful. So I think that's huge. One more question for you, Leslie. Since you work with so many different schools, so many unique implementations that you help facilitate as you work with faculty, could you just give us a couple of just anecdotal maybe or experiences of what you have seen worked well for pharmacy programs that you're partnering with?
Absolutely, yeah. So one of our schools has actually tied the content to the students' API rotation. They are requiring students to answer a number of QBank questions for each rotation with a minimum percent correct, right? Because if you're giving students a number of QBank questions, you're not wanting them to just hit A for all 150. You want to really look and answer. And our system tracks all of that, and we're able to provide the report to the faculty. So the students are hitting a number of questions per rotation. So let's say, I don't know, 100 questions per API rotation at 65 to 70% correct. And then those faculty are reporting that the PCOA scores have increased with the cohorts that have been using high yield in comparison to the cohorts that did not use high yield. Another successful approach is that institutions are using our NAPLEX practice exams. They're giving it once in December or January, around in there, really early in the year. And then students receive individualized reporting that shows how they performed across the domains. And then they are having the students use those to create a self-study plan or remediation plan to shore up the gaps. So they're having the students, requiring the students to look at the data and identify their own gaps that our system provides. And then they've got from January to May to develop a self-study plan. How am I going to get stronger in biostatistics or cardiology or oncology? And then the key component really that I've seen is the requirement. All what I'm saying is that having the students use our NAPLEX review components, consume the content with an emphasis on using the practice NAPLEX exam and the QBank data that we provide to then identify the gaps and then put together a plan. How are they going to shore up those gaps that exist with lecture watching or focusing? Our system also allows them to focus QBank questions just in the domains that they are weakest in. They can select at random across all or really focus in where those weaknesses exist.
Thanks, Leslie. It's really helpful. Well, thank you all for joining us today, both our attendees. Thank you to our participants today. We really just wanted the opportunity to kind of think through and talk through experience. We know that we have a lot of faculty we have the privilege of working with, and there's a lot of faculty we get to talk to about the challenges they're facing. So this is not a sales pitch, but if you are participating with us today, or if you watch this on demand later, and you're thinking through your own challenges at your own pharmacy program where some of our tools might be able to integrate in, I hope you're getting a feel that what we've designed really purposefully, and that we're really committed to the success of our institutional partners, both the students and the faculty. We really do believe in partnership. So if you'd be interested in a demo or a free account to kind of experience this content for yourself and see where it might fill in some gaps for your students, where it might help prepare your class to do better on the NAPLEX and be better prepared for clinical practice, it'd be our privilege to set up a time with you and take you through that and give you access to those tools so you can see them for yourself. So thank you so much for joining us today, and please feel free to reach out to us with questions. Thank you, Dr. Besti, Dr. Bowen, especially for taking time today. All right, everyone, have a great day. Thanks again.
Thank you. Appreciate it.